Good morning, sir.
Morning.
My name is Ocular. I'm a clinical associate, first year student. Okay, today I'll be doing a head-to-toe exam to you, examining all your body system. Is it okay with you?
It's okay.
Before we start with our exam, I'd like to ask you a few questions. Can I please confirm your name, sir?
I'm Jerry.
Okay, Mr. Cherry, how old are you?
I'm 26.
Okay, do you know where you are now?
Yes.
Can you please tell me?
Pretoria, University of Pretoria.
Okay, do you know why you are here?
Yes.
Can you tell me?
For you to examine me.
Okay, do you know what day of the week we are in?
It's the 6th of November.
Okay, 6th of November. Which day in the week?
It's Tuesday.
Tuesday. Okay, thank you. My patient is well orientated to time, place, person, and situation. His mood is relevant to the situation, and his facial expression is also relevant to the situation. He's well nourished. His age is also relevant to his physical appearance. Okay, sir. Now I would like to start, take your vital signs, the blood pressure, the pulse, the heart rate, and the respiratory rate, okay? Thank you. This is the temperature, the vital signs. Please, can you put this under your axilla? Tell me when it beeps, okay?
Okay.
Just compare the radial artery. It is brisk and tapping bilaterally. And I'll have to take the heart rate of the patient for 30 seconds. My patient's heart rate is 70 beats per minute. And I have to take the respiratory rate for 30 seconds also. My patient's breath is 18 breaths per minute. His temperature is 37 degrees Celsius. Then I'll have to take the blood pressure. Firstly, I need to relocate the brachial pulse. It's there. Then I put my calf 2 centimeters above the brachial pulse. Then I have to palpate the radial artery and inflate until it disappears. Okay, it disappears at 120. Then we deflate completely. We'll wait for 30 seconds. Okay, 30 seconds is finished. Again, I'll relocate the brachial pulse. Then I'll put my stethoscope. And inflate it again. From the 120, now I will add 30, which I will inflate to 150. Then deflate it slowly. Okay, my patient's blood pressure is 120/90. And let me calculate here. We are done with the vital signs. Now, sir, I would like to examine your nails and your skin. Okay. Can I please have you? Palpate the bed of the. There is no sign of clubbing on the nails. Can turn this side. And capillary fill is less than a second on the hand. Okay. Also on the feet. There is no sign of clubbing on the feet, and the capillary refill is less than 2 seconds. And the skin color is light and homogeneous, with liquid hair distribution on the legs, also in the arms. There are no scars, no lesions on the skin, and the skin texture, it doesn't have any sign of dehydration. It is fine. Okay, so we are moving right along. Now I'm going to examine your head. Okay. Do you have any pain in your head? Okay. The head is normal cephalic with even hair distribution, or you see just one lump on the right of the patient's head. Also in the back of the patient's head. It's just few lumps. Okay, so now I'm going to palpate your head. Please tell me if you feel any pain, okay? Any pain? Okay. There's no masses palpable on palpation, and there is no tenderness on palpation. Now I have to palpate the temporal artery bilateral. It is brisk and tapping bilateral. I can rate it on a scale of 2+. Now I have to examine the TMJ, temporal mandibular joint. Do you have any pain right here, sir?
No.
Okay. Please tell me if you feel any pain. Please open your mouth. Close it. Open. Close it. There are no crepitus on the palpation of the TMJ joint, and there is no tenderness with palpation. So now I'm going to examine your face, okay? Can you please frown for me? Just frown, your face, wrinkled. Okay. Can you please smile? Okay, facial nerve number 7, the cranial nerve number 7, the facial nerve is intact. My patient is able to smile and frown. Now we'll examine the cranial nerve number 5, the trigeminal nerve. Okay, we'll start to test the light touch. Okay, before we do the light touch, sir, can you please move your jaw side to side? Okay, thank you. Can you please close your eyes, then tell me if you feel anything touching you?
I can feel it. I can feel it. I can feel it. I can feel it. I can feel it.
Okay, my patient is able to detect the light touch. You can open your eyes. This is sharp, this is dull. Okay, can you please close your eyes, then tell me whether it's sharp or dull?
Sharp. Dull. Dull. sharp, down, sharp.
Okay, my patient is able to detect the light, the sharp and down. Now I'm going to examine your eyes. Okay. Firstly, we have to do the visual acuity. Okay. Can you please come and stand this side? Okay, now we are testing cranial nerve number 2, the optic nerve. With my patient standing 3 feet away from the chart, he's going to identify for me first these letters. Sir, can you please tell me these letters?
A, O, E, H, L, A, N, T, C, O.
Okay, can you please with that card close one eye? Tell me.
E, O, E, H, L, A, N, T, C, O.
Okay, can you close the other eye? Also read for me.
O, E, H, L, A, N, T, C, O.
Okay, thank you. You can go back sit on the bed. Okay, cranial nerve number 2, the optic nerve is intact because my patient is able to identify those letters. Okay, so now I'm still on the eye, okay. On inspection of the eyebrows and the eyelashes, they look symmetrical bilaterally. There is no leak leg and any swelling of the eyelids and no swelling of the lacrimal gland and the lacrimal duct. Do you have any pains around your eyes?
No.
Okay, I'm going to palpate the lacrimal gland, the lacrimal sac. There is no signs of swelling. Can you please look up for me? Okay. Thank you. The conjunctiva is pinkish in color, simply bilaterally, and the sclera is white. Inspecting the pupil of my patient is round in shape. I can rate it in a scale of 4 millimeters bilaterally. They are symmetrical. I'm going to check for light reaction to the pupil. The pupil reacts to light, direct and indirect. They react to light. So can you please look at this light? The light reflection is symmetrical bilaterally. We're gonna do the accommodation and convergence. So can you look at this pen? My patient's able to accommodate and his eyes converge to able to see this object. Now we're gonna do the visual fields. So can you just close one of your eye? Just look me straight in my nose and tell me the minute you see my finger. Okay? Don't move your head, just look me straight here. The minute you see my finger, just tell me.
You can see your finger.
Okay.
You can see your finger.
Okay, thank you. Can you close that other eye? Also look straight to me in the nose. Yeah, also close my eye. Tell me if you see my finger.
You can see your finger.
Okay. This side.
You can see your finger.
Okay, thank you. The temporal vision and the nasal vision of my patient is intact. Now we're gonna do the extraocular movements. So just don't move your head, follow my finger with your eyes only, okay? Okay. Extraocular movement is intact. Cranial nerve number 3, 4, and 6. The oculomotor, the trochlear, and the abducent nerves, they are intact. Okay, so now I'm going to look inside your eye, okay, using that tool, okay. Then examining the right eye of the patient with my right eye. My diopter at 0. At the arm's length. I can see the light reflection. When I go in, just focus on the mirror. You can see the blood vessels. The optic disc is yellowish, orange, and is round in shape. No papilla edema. Okay, thank you. We'll also examine the other eye using my left eye to examine the patient's left eye. From the arm distance, I see the red reflection going in. See the blood vessels. The optic disc is orange, yellowish orange, and there is no papilla edema. Thank you. Okay, so now I'm going to examine your ears, okay? Do you have any pain in your ears? Okay, in inspection of the ears, they look symmetrical bilaterally. No scars nor lesions around the ears, and there are no discharge in the ears. Please tell me if you feel any pain while I'm palpating your ears, okay? No tenderness on palpation, also in the smart thought process. Okay, now we will do the hearing acuity. I have to whisper to you, okay? And tell me what I'm saying. Or just occlude this ear. Tell me what I'm saying.
99.
Okay. Also occlude this ear and tell me what I'm saying.
5.
Okay. The cranial nerve number 8 is intact. My patient is able to hear the whispered sound. Now I have to look inside your ears, okay? Using the otoscope. Firstly, start with this ear. There is no sign of inflammation in the ear canal and no foreign bodies. There's little hair distribution and cerumen. The tympanic membrane is grayish in color with little reddish of like vessels in it. Okay, I'll also do the same on the other, using the other hand, inspecting right inside. Also there, little hair distribution, no signs of inflammation of the ear canal. The eardrum is grayish in color and no perforation. It looks symmetrical to that one. Okay, thank you. Now we have to test for the Weber test. Do the Weber test and the ring test. Okay, so I'm going to put this in the middle of your head. Tell me where you feel the vibration on the sound. Okay?
Both ears.
Okay. Now tell me when the vibration stops, okay? I'll just put this behind you. Tell me when the vibration stops.
Stopped.
Do you still hear the sound?
Yes.
Okay. I'll also do the same. Please tell me when to stop vibration.
Stopped.
Okay, do you still feel the ear?
Yes.
Okay. There's no lateralization of the sound. My patient is able to hear the sound within the vibration on both ears. On the ring test, air conduction is greater than bone conduction. Okay, now say I will examine your nose, okay? The ala of the nose looks symmetrical bilaterally. There are no scars, no lesions around the nose, and there are no discharge from the nose. I'll use my pen light to look inside the nose. Before I look, do you have any pain in your nose? Okay, just start palpating the nose. Also, the sinus, they don't look like they are inflamed. There's no redness in the frontal sinuses and the maxillar sinuses. Do you have any pain in your sinuses? Okay, we'll palpate the frontal sinus and the maxillar sinus. There's no tenderness on palpation. And now I'll have to look inside your nose. Can you please just tilt your head up and just look? There's little hair distribution inside the nose. The nasal mucosa is pinkish in color. The nasal septum is in the midline. No bleeding, no foreign bodies inside the nose. Okay, thank you. We have to test for smell now. Do you have any problem with smelling? Okay. Can you please just close your eyes? Then occlude one nostril with one hand. Can you please tell me what do you smell?
Spirit.
Okay, occlude the other. Tell me what do you smell?
Spirit.
Okay, thank you. My patient is able to smell which cranial nerve number 1, olfactory nerve, is intact. Now say I have to examine your mouth, okay? On inspection of the lips, there is no sign of cyanosis, and there are no lesions, no scars, no crackings around the lips. The lower lip looks pinkish in color, okay? I have my pen light and the tongue depressor. Can you just please open your mouth and just do like this for me?